Hi, I'm Dr. Jerry Hesch, physical therapist at the Hesch Institute in Aurora, Colorado. And I treat clients with complex low back pain, whole body pain, and sacroiliac joint dysfunction. We also have a home study program for clinicians, and we also present workshops. And I have a book chapter in this book and a book chapter in this book, and I also have a 300-page workbook and also advanced material for clinicians. My presentation today is titled Initial Sacroiliac Joint Dysfunction Diagnosis is Only Partially Correct. So unraveling the mystery of a sacroiliac joint injury is somewhat like peeling an onion. The outer layers get thrown out. So if I were to diagnose you on the first day with an arbitrary example being a right anterior ilium, a left posterior ilium, and left sacral rotation, which describes positions in which mobility is increased and positions in which mobility is decreased. And then if every following visit I treated that same pattern, I would be doing you a grave disservice. Why is that so? Because common patterns are easy to resolve in one visit, at which time I teach the client self-treatment that maintains that gain of mobility and gain of stability. In resolving the pattern in one visit with the Hesch method, when the client returns for a future visit, we retest them and typically find that in fact that pattern is being maintained with the correction of that pattern is being maintained with the home program, which is very simple. But what emerges is a deeper pattern, which I call a permutation. So it would be wrong to be doing the same treatment every visit based on the first day diagnosis. And here's an example of a recent client with low back pain and sacroiliac joint dysfunction. And this client is someone that I saw over the past week, and he's an extremely fit athlete and a personal trainer. And on day one, I corrected what we name a right anterior ilium, left posterior ilium, and left sacral rotation. On visit number 2, a week later, this pattern remained corrected. However, a permutation emerged in which another pattern announced itself, which is a pattern I've discovered and named left lower pelvic windswept pattern. So I corrected that pattern, and then his pelvis was symmetrical. Now, there's a misunderstanding that the pelvis must be asymmetrical in order for there to be abnormal movement in the pelvis, and that's simply not true. What he presented with once we corrected the previously described patterns is he presented with movement when I did a spring test or joint stress test on the lower sacrum. But when I came to the upper sacrum, with him lying prone, the sacrum did not have mobility. So basically the sacrum did not have forward bending mobility, and I like the term forward bending. The traditional term is nutation. They both mean the same thing. He did not have nutation mobility. And so I then treated that nutation, and I also treated a compressed 12th rib, and at that point he was significantly better, and pelvis was symmetrical, except for a slight asymmetry which was developmental, that will always remain, but it's not associated with a movement deficiency. His pelvis simply developed a little bit asymmetrically side to side. And so I'm much more interested in how it functions, how it moves, and how stable it is. So the takeaway message of this presentation is 1, sacroiliac joint dysfunction may involve several permutations similar to peeling an onion. And reevaluation at every visit after the first visit is necessary to screen for other patterns. And I will post 2 videos on the case study of that individual I mentioned, and you'll be able to see the gain in movement, at least with respect to the sacral lack of forward bending or nutation mobility. And I hope that this is helpful to you. Thank you very much.